I'm Sarah Williams, and I'm a student nurse here at South. Here is my ID. We can scan the room. And today I'm going to be doing the IV start and discontinue checkoff. So I'm going to do the start first and then the discontinue at the end. So the first thing I'm going to do is I'm going to verify my hospital policy and verify my order. And then I'm also going to gather all of my equipment and bring it to my room. Once I enter my room, I'm going to perform hand hygiene, and then I'm going to verify that I have the correct patient. So I'm going to take my patient care order form and use two patient identifiers. So we have Jaguar Jones. His date of birth is 08/25/1963, 08/25/1963, and then I can also see here he is allergic to penicillin. So now that I have verified my patient, I'm going to tell him what I'll be doing. So I'll explain the procedure, and then I'm going to position my trash can. I'm going to perform hand hygiene again and then put on my goggles. And now I will raise the patient's bed. I will lower the side rail, and I'm going to make sure that he is in either supine or sitting position, whichever is more comfortable for him. And now I'm going to go ahead and organize all of my supplies and open them up using aseptic technique. So I will open this first. Discard that, and then open this one, and discard this. Go ahead and open this. Okay, and now I'm going to go ahead and prep my saline lock and my saline. So I'm going to take this and let me fix this really quick. We'll pretend like this was already done. Okay, so I'm going to take my saline. Or not my saline, my extension kit, and then I'm going to grab a alcohol swab, and I'm going to clean this, and then throw that away. Now I'll grab my saline. I'm going to open this up and then connect it. Oop. Okay, and then I'm going to set this here. Oh, nope, I'm going to loosen this just a little. And then I'm going to prime the line. Oop, didn't loosen it enough, I guess. Okay, so I primed it, and now I'm going to set it back in here. And then I'm going to open my needle and get that close. And then I'll open my Tegaderm. So now what I'm going to do is I'm going to select a vein. So I'm going to find a vein that is in the non-dominant arm if possible, a vein that's in the most distal site, and a place where there is no inflammation or infection, or pain or a wound, anything like that. And then I'm also going to promote or foster venous distension by applying warmth for several minutes to foster venous distension or vasodilation, or I can have my patient open and close their hand several times, or I could stroke the vein lightly a few times as well. So now that I have selected my vein, I'm going to go ahead and put on my my tourniquet. So I'm going to place this 4 to 6 inches above the site that I selected. Okay, and then I'm gonna go ahead and put on my clean gloves. Oh, before I put on my clean gloves, I'm going to check the radial pulse, make sure that it's there, and then after I've done that, I'll assess the vein, and then if I didn't detect the radial pulse, then I would remove the tourniquet and then give him a few seconds, few minutes, and then start over. So now I'm going to put on my clean gloves, and I'm going to clean the area that I selected with my chlorhexidine swab. I'm gonna make sure that I move this closer to me, take my chlorhexidine, and I would pop this, but I'm not actually gonna pop it just so that I don't get it everywhere on my area. So to clean this, I'm gonna use friction, and I'm going to go vertically and clean it, then I'll go horizontally and clean it, and I'll do it in circular motions to clean it. I'm gonna do this for 30 seconds. And then after it is clean, I'm gonna go ahead and throw this away and then give time for that to dry. And I'm gonna make sure that I don't touch the area that I just cleaned. And so now I'm going to take my catheter. I'm gonna go ahead and open this. I'm going to anchor 1.5 inches to 2 inches below the area that I selected without touching the area that I cleaned. And then I'm going to go bevel up 10 to 30 degrees into the skin parallel without touching the catheter to my thumb. So I'm going to go in like this. And then once I saw blood return, if I saw blood return, which I would if this were not a pool noodle, but anyway, I'm going to drop the needle, and then I'm going to go parallel another 1/4 of an inch. And then while stabilizing the needle, I'm going to push the catheter up to the hub. Then after I've done that, I'm going to pop the tourniquet, apply pressure here, and then remove this, throw that away, and quickly grab this. So I'm going to take off this part. If I can get it off, come on. There we go. Connect it. And then I'm going to put my tape on, which that wouldn't come out normally. So I'm gonna put my tape on, and then I'm going to aspirate for blood return, and then flush the vein, which I'm also not going to do just to prevent the water getting everywhere here. So after this is done, I can remove this part, put it in the shock container, and then I'm going to go ahead and put on my Tegaderm. So I'm going to remove this and place my Tegaderm here, making sure not to go over the green area. And then I'm just going to remove this portion. And I'm gonna hang on to this because it has my label on it. And then I'm gonna remove this piece carefully so I'm not hurting the patient. Put that in the trash, and then I'm going to take this and let this fall in a natural way and place my tape over the top of it to hold that down. And then now that that is done, I'm going to discard of my things. So I'm going to go ahead and discard of this and all of my wrappers and everything. And then I can take off my gloves. And then I'm going to label this on the Tegaderm patch with the date, the time, and my initials, and also the gauge of the needle that I used. And then this part goes here on the edge of the Tegaderm. And then once I have done that, I'm going to go ahead and lower the bed, raise the side rail, make sure my patient is comfortable. I'm also going to tell him the ways to prevent the IV dislodging, and I'm also going to tell him signs and symptoms to watch for from IV complications. And then after I'm finished with that, make sure he's comfortable, everything is correct, I'm going to head to the nurse's station so I can document. And what I'm going to document is the date, time, location of the IV, the number of attempts that I used to stick him. I would also document the length and gauge of the catheter and needle that I used. And then I'm also going to document the presence of the saline lock, or if there was any fluids prescribed, I would document the flow rate and method of infusion for that. And that would complete the insertion part. I would also perform hand hygiene before I left the room, which I didn't do that, but I would perform hand hygiene before I left the room, and I would tell my patient that he needed to stay still because when I stuck him, which I forgot to do that also. But those are two things I would do before I leave the room. But since that part is done, now I will show you how I would discontinue the IV. So I'm going to take these off for just a second since they're a little foggy right now. So what I would do for discontinuing the IV is I'm going to make sure that I have the order to discontinue first of all, and then go through and verify everything again with my patient, make sure that I have all of that good stuff in order. And then I'm going to enter the room. I'm going to perform hand hygiene again, and then I am going to put my goggles on, which they're not foggy anymore, goodness. Okay, so I put my goggles on, and then I'm going to put on my clean gloves. And I don't have any gauze with me today, but I'll just verbalize the use of my gauze and show you how I would use it. But anyway, what I'm going to do coming into the room is I'm going to tell Mr. Jones what I'll be doing, discontinuing his IV. I'm going to remove this tape first, if I can find a place to pull it up from. Oh, come on. There we go. So remove that tape first. And then I'm going to remove the tegaderm by pulling it up and towards the catheter. And then I would have my gauze in this hand. We'll pretend the gauze is here. And I would pull this out and place the gauze over the top. I'm going to inspect my catheter and make sure that it is intact. If it wasn't, I would document. If it is, I'm going to also document that. And then this is going to go in the sharps. And then I'm going to look at my patient, and I would clean up his arm with this gauze. If there was any blood or anything, I would look at the insertion site to see if there was any redness, any irritation, pain, inflammation, drainage blood, anything like that. And then I'm going to place another piece of gauze over the top of this, and then I would take my tape and secure the gauze with my tape. And then after that, that would complete my discontinuing of the IV. Thank you.